about the topic of hand in the upper limbs. Now we will discuss about anatomy of the hand. Phalanges, distal phalange. Middle phalange, proximal phalange. Distal phalange. Proximal phalange, metacarpus. Hamate triquetral carpus pisiform. Ulna and metacarpal trapezoid trapezium. Capitate scaphoid lunate radius. View of the hand, PA, oblique and lateral. Indication. Fractures and dislocation of metacarpals. Direction and centering of the X-ray beam. Postero-anterior. Position of patient and cassette. The patient is seated alongside the table, with the affected arm nearest to the table. You can see the position of the patient. Direction and centering of the X-ray beam. The vertical central ray is centered over the head of the third metacarpal. You can see the PA view show the fourth and fifth metacarpals fracture. Anterior oblique. Position of patient and cassette. From the basic postero-anterior position, the hand is externally rotated 45 degrees with the fingers extended. You can see in the picture. Direction and centering of the X-ray beam. The vertical central ray is centered over the head of the fifth metacarpal. You can see the picture show the anterior oblique radiograph of right hand showing fracture. Neck of fifth metacarpal, boxer's fracture. What is boxer's fracture? Boxer's fracture of the neck of the fifth metacarpal is seen easily, but conspicuity of fractures of the bases of the metacarpals is reduced by over-rotation and underexposure. Lateral. Position of patient and cassette. From the postero-anterior position, the hand is externally rotated 90 degrees. You see in the picture. Direction and centering of the X-ray beam. The vertical central ray is centered over the head of the second metacarpal. This picture showed the lateral radiograph of hand with foreign body marker. There is an old fracture of the fifth metacarpal. Radiation protection. If it has been necessary to position the patient facing the table, it is essential to provide radiation protection for the lower limbs and gonads. This may be achieved by placing a lead rubber sheet on the table underneath the cassette to attenuate the primary beam. Centering of the X-ray beam. 1. PA. Third metacarpal. 2. Oblique. Fifth metacarpal. 5. Lateral. Second metacarpal. Cassette size for hand X-ray. 18 by 24 cm. You can see in the picture. Examination of hand. Position. Exposure factors. AP. Oblique. Lateral. KVP and MOS R. 50_6010_15. SID. 100 centimeters. Normal hand versus rheumatoid arthritis. Bone displacement, bone erosion. Rheumatoid arthritis, osteoarthritis. Destruction of joint. Erosion of bone. Normal finger. Displaced thumb joint. Deviation of finger. Fused wrist joints. Heads of 2 ND_5 TH metacarpals. Epiphyseal plate. Base of first metacarpal. Epiphysis.